Now let's discuss dopamine hypothesis of schizophrenia and mesolimbic dopamine pathway and positive symptoms. The mesolimbic dopamine pathway projects from the dopaminergic cell bodies in the ventral tegmental area of the brainstem to the axon terminals in one of the limbic regions of the brain, namely nucleus accumbens in the ventral striatum, as shown here. Now this pathway has an important role in several emotional behaviors, including the positive symptoms of psychosis such as delusions and hallucinations. Also, it is very important for motivation, pleasure and reward. Now it has been observed that diseases or drugs that increase dopamine will enhance or produce positive psychotic symptoms, whereas drugs that decrease dopamine will reduce or stop positive symptoms. It is very interesting that stimulant drugs such as amphetamines and cocaine release dopamine and if given repetitively can cause paranoid psychosis, which is virtually indistinguishable from positive symptoms of schizophrenia. All known antipsychotic drugs capable of treating positive psychotic symptoms are blockers of dopamine D2 receptors. Thus, hyperactivity of the mesolimbic dopamine pathway hypothetically accounts for positive symptoms, whether those symptoms are part of the illness of schizophrenia, drug-induced psychosis, mania, depression, or dementia. Furthermore, hyperactivity of mesolimbic dopamine neurons may also play a role in aggressive and hostile symptoms, especially if the serotonergic control of dopamine is aberrant in patients who lack impulse control. Current theories now state that it is the downstream consequence of dysfunction in prefrontal cortex and hippocampal glutamate activity.